Hello and welcome to another episode of Fridays with Fawn. I'm Fawn Lopez, publisher of Modern Healthcare and Vice President at Crane Communications. Joining me today is Colleen Lindholz, President, Kroger Health. Colleen, thank you for joining us today.
Thank you, Fawn. Honored to be here. I appreciate the invite.
Thank you. So I just want you to know that Kroger Health was the very first grocery store that my family and I shopped at when we first moved to the United States.
Wow. So you first shopped at Kroger. That was your first grocery store that you went into.
Can you believe it? Yes. We were refugees from the Vietnam War. Okay. And it was nothing like the markets that we were used to. And so it was such an experience that I will never forget. So
that's awesome.
It's an honor to have you with us today.
Thank you.
So Colleen, you, I believe, started with Kroger Health in the late 1990s.
Yes. Yeah. I started with Kroger actually in 1995, Fawn, when I graduated from pharmacy school, the University of Cincinnati. I went with Kroger in 1995. And I say it's the best decision that I ever made. And the reason I say that was the opportunity that it gave me to practice pharmacy inside of a grocery store where people visit more often, where they, visit 2.5 times a week. And it gave me an opportunity to really develop relationships with people that went far beyond our counter. So, I've been with Kroger for 27 years and it's been a wonderful experience.
So it's really, really cool that you started out as a pharmacist. And I've always wanted to be a pharmacist, by the way.
It's a great profession, by the way. What you get to do for people and the differences that you make each and every day, it's outstanding.
So I changed my mind after organic chemistry, by the way.
That was a tough one. Inorganic chemistry. Chemistry was a tough one for me to get through also.
Okay, so you have talked about your nonlinear path to your current role as president of Kroger Health. Mm-hmm. Can you share with us what did you learn from taking the road less traveled?
Yeah, Fawn. So that's a really great question. And I'll tell you what I have learned from taking the road less traveled is that sometimes when you take a step sideways or backwards, you can really learn a tremendous amount that then will help accelerate, any type of leadership role or strategy that you're going to take moving forward. And what I mean by that is when I took a step back and I went through the management training program at Kroger so that I could more or less understand the total store, understand the total grocery store more, understand our total customer, from the customer's lens more. And that's what really, really helped me. I love it also because I've been able to understand the importance by taking the road less traveled of purpose and vision and mission, and really making it very clear to people about how you have to set the purpose, vision, and mission, and you have to make it very clear. I've learned that leadership along the way should be very boring. And some people will look at me and say, what? Leadership is boring. And I think that's just because of the consistency. Like you really do need to set the path, which we did a while back with our vision and our mission and our strategy overall, so that you can, continue to push forward, and that so everyone understands like where you're going and what you're doing and why you're doing it.
So true. So let's talk a bit about COVID. You were instrumental in leading Kroger's COVID-19 response, including fostering access to vaccines and combating vaccine hesitancy. What were some of the strategies you implemented that led to Kroger's success in administering more than, I believe, 4.7 million vaccines?
Well, in total, Fawn, this is a really good number. It's over 11.5 million vaccines to date. So yeah, we hit well over the 11.5 million mark actually last week. But to tell you the truth, the safety of our associates and our customers have always been at the forefront. It always has been for Kroger. And really during the pandemic, we had a strategy in place and we were driving vaccinations and really driving our healthcare professionals to be practicing at the top of their licenses. So when it came time to answer the call for the country with COVID vaccines, I tell you, I had pharmacists volunteering to go to the off-site clinics that we had. So not just within our stores, but beyond our four walls. I had more people volunteering to go and be a part of the vaccination clinics and things because they knew they could be a part of something that was bigger than themselves, that we were driving towards an overall, again, vision and mission. Our vision is to help people live healthier lives. And what this was not a better time than for us to go out and do that. So I think a strategy inside the company that we did lead, though, was truly around the tech side, the technology side, because we had to put together, a scheduler and be able to qualify people. How eligibility was very different early on during the beginning when the COVID vaccine rolled out. Really collaboration across the country so that we could move at a pace that mattered. And then a key piece of the strategy, Fawn, was around partnerships, because we knew that we couldn't do it alone. So we picked a partner in Gravity Diagnostics, who was our lab where they were able to process our testing, quickly. We picked them as a partner. Of course, the government and the Centers for Disease Control, both on the federal level as part of the pharmacy program, and then at the state level. I think the state level partnerships were really critical for us early on to be able to not only get access to the vaccine, but to be able to execute and get to more people more often. One thing that I'm really proud of is our partnership that we had with Major League Baseball. We were out to try to increase the vaccination rates of the Black and brown communities and the underserved. And so we partnered with Major League Baseball. We called it Take One for the Team, where we were trying to, go out there and educate and get more people vaccinated. So that was a really good partnership. And then we also, I don't know if you realize this, but we gave away $5 million. We gave $1 million away to 5 people during that first year, because we were trying to, again, get vaccination rates up. So really happy and proud of my CEO, Rodney McMullen, who said, hey, we're going to do whatever it takes to help people. And so we went out with we called it community immunity, trying to get more people vaccinated. And it obviously worked out. It worked out for us, and we were able to save more lives. And that's what was really important to us, that we were able to make a difference.
100%. And, healthcare is something I say all the time, that I feel such an honor and a privilege to be part of this industry, because it is truly a mission-driven industry. Mm-hmm. And the industry has stepped up in the most amazing way during the pandemic. And congratulations to you on your success. Yeah. And more importantly, the impact that you and Kroger Health made in your communities.
Well, Fawn, I have to tell you, I have to give a plug for our country's pharmacists, just in general. Do you know that the country's pharmacists gave 2 out of every 3 of the COVID vaccines in our country? So, without the community pharmacists and the pharmacists across the whole country, we wouldn't be in the position that we're in. Yeah. So I'm just really proud of the profession and how we stood up and were there for the American people.
So important. Thank you for the recognition. So you touch upon in your last response comment a bit about innovation. Truly, the pandemic has accelerated digital health innovation and implementation, which you at Kroger Health have clearly done. How, in your opinion, can technology innovations in pharmacy improve the care outcomes, and maximize reimbursement for services?
Yeah. So obviously with COVID, with the pandemic, I feel like, technology went from 0 to 60 overnight. People being willing to use like telehealth, people being willing to use different types of services in order to get the products and what they needed. So I think technology will always, of course, be there to help enhance. Access is a big deal, access to services, period. So during the pandemic, we were lucky enough to be able to deploy telenutrition services across the entire country on our telehealth platform. And, we helped thousands and thousands of people, and not just people that shopped at Kroger. So that was something that we did during the pandemic and that we still do today. And I think from a technology standpoint, too, we've been working on our food as medicine strategy. I think you know that. And we've been working on a nutrition scoring system called OptUp. And so you think about technology and how technology can simplify things for our customers and the people that we serve. And so OptUp is a way of simplifying nutrition for our customers so they can very easily understand, like in a commodity like yogurt or like cereal that they may be shopping in, how they can opt up to a product that has a better nutritional value. So we're just excited about the breakthroughs in innovation and technology, the things that we're working on that really simplify things for customers and make it easier for them, to make a healthier food choice or make it easier for them to live a healthier life.
You're very passionate about the role of food as medicine. How can doctors and pharmacists collaborate more effectively to incorporate this concept into patient care? And what is Kroger doing to support this?
Yeah, so food as medicine, obviously, it's essential. We believe it's essential to that more holistic approach of taking care of people, Fawn. And we have defined food as medicine as an educated, dedicated, and personalized approach to helping people eat healthy and actually enjoy food so we can prevent illness before it starts. I think the definition of it is really, really important, especially the very end of it, because we really believe in that comprehensive approach and actually preventing disease before it starts. And what we're trying to do is work collaboratively across hospital systems and across like with physicians to make it easier for them to understand sort of the nutritional score or how their patient is eating. So we have come out with Opt Up, which is a nutrition scoring system that allows a customer to very easily make a better food choice to opt up to an item that has like a higher nutrition score. And then we've also built a system that sits on top of our fulfillment system in pharmacy and our electronic medical record in our clinics that communicates back to physicians so that we can keep them up to date with where their patients are as far as, what they're eating and more of that, like in that comprehensive approach to food as medicine. So we're working on the communication piece, and we're also working on the research piece. So we've done 2 research projects. One, we just got the results of, it's called SuperWin, Supermarket Web Intervention Targeting Nutrition, that came out. We collaborated with the University of Cincinnati and Dr. Dylan Steen to study the impact of not only Opt Up, but our dietitians and what they could do to help people make healthier food choices and really follow the DASH diet. It was people that had cardiovascular disease and that have had a stroke. And Fawn, the results were amazing. I mean, I believed in what we were doing, but when you do a research project, it's going to be published no matter what. And so the results were statistically significant. It was actually the second best nutrition study and the outcomes that has been done in the country, period. So we're really excited about being able to prove out food as medicine. So either working with physicians directly to help them understand their patients a little bit better, and also the research piece behind it, I think will give them confidence in what we're doing and that we can really move the mark.
100%. And congratulations. That is amazing. Good for you. Thank you for doing that. Being that, modern healthcare's audience, it's consists of over 70% of our audience is folks, leaders, executives, professionals from the hospital health system side. How can doctors and pharmacists collaborate more effectively to incorporate this concept of food as medicine into patient care?
Yeah, that's a really great question. And we've been working comprehensively on trying to help connect us, because I really believe that the future of healthcare in our country is interprofessional, not siloed. And what we believe by that is that it takes all of us, whether it's the primary care physician or it's the dietitian or the pharmacist or even the nurse practitioners that are sitting inside of our clinics inside of our stores. It takes us all like working together in order to comprehensively take care of the patient. So one of the things that we've been doing to try to help the physicians and the partners in the country with food as medicine is we built a platform. It's called AssureCare that sits on top of our fulfillment system in pharmacy and our electronic medical record in our little clinics. Those are our convenient care clinics in the country that will connect back with physicians and hospitals or in doctors' offices so that we can, one, have more ongoing regular communication on how their patients are doing. But secondly, we aspire to embed a nutrition score back into an electronic medical record so that doctors can better understand how their patients are eating. Because, we all know you are what you eat, and we all know that nutrition plays a key role in either the prevention or even the being able to manage chronic disease. So some of the things that we're working on is to simplify, for them. And then also so that we can, collectively, we're not trying to compete. We really are trying to collaborate or coordinate care with the local physicians. So we're really excited about the pilots. We've also done some piloting around nutrition prescriptions. And I will have to tell you that at first we failed miserably in the pilot where we were trying to actually have people take physical prescriptions in, like you would take a prescription in from your physician, to our stores. But we pivoted quickly and found that wasn't going to be scalable. So now our dietitians are meeting with our customers or their patients online, like you and I are right now.
Mhm.
And they're basically adding to the cart and helping their patients pick out the food and the nutrition that's proper for them, that's very personalized for them, by the way, too. Because as part of our food as medicine strategy, we really believe it's a very dedicated, educated, and personalized approach to helping people eat better, because food is very emotional. Fawn, I
Yeah.
think you know this, right? There's cultural stuff behind it. It's very emotional. And so we really do have a streamlined approach to personalization around food as medicine, and to also allow the physician, give the physician back sort of that report or that score of how their patient is eating, how their nutritional security looks.
I love hearing about the collaboration with physicians and your partnerships with other stakeholders.
Yep.
It's so, so important. So let's talk a bit about the impact or the effect of the pandemic on our caregivers. We know that caregivers of all sorts, all types, are struggling with burnout from the pandemic. How is this affecting pharmacists? And what would be the impact on patient care? And more importantly, what can be done to combat this burnout?
Yeah, that's a loaded question. And obviously during the pandemic, in the very beginning of it, the healthcare workers that were on the front lines of the front lines, obviously rallied around each other. We stayed open. We never closed. And during the rollout of the vaccine, in 2020, 2021, we had people that were just so appreciative. Like the public overall was so appreciative. People crying as they were, getting their vaccine, knowing that they then could go and see their mother or see their grandchild that was born during the pandemic for the first time. And I felt like it was a much different sort of sentiment around what was going on. But it also caused a lot of our pharmacists at Kroger that were going to retire to really retire early, because it was tough. We still had to fill those prescriptions. We gave 5 times the number of vaccines that we had ever given in 1 year, that first year. And so it was definitely a load. So what we're doing with coming out of it is we launched a project at Kroger called Project Passion. And Project Passion is really all about bringing ourselves back to, why did we go to pharmacy school? It's a recommitment of ourselves to the greater good and the service to all humankind, which that's exactly what it says in the oath. But it's also about the well-being of our healthcare professionals, and making sure that we help them take care of themselves first, so that they can be great in front of the technicians and the people that are all around them, and then also our customers. So we're excited about Project Passion. We're having a lot of success. We've rolled it out in 5 of our Kroger divisions around the country so far. But I think, Fawn, it's a combination of continuing to work on simplifying things, by the way, for our pharmacists and our technicians and our nurse practitioners, so that they can spend the time that they need with the customer at the counter. What I mean by simplify is we've increased percentage of automation that we use in our stores, whether it be robots or central fill facilities that actually help release some of that volume, so that they can provide the optimal patient care and the time that they need with the customer at the counter. We're doing things like that, but they're also bringing them back to their roots. And I say I went to pharmacy school to take care of people, and I have a passion and really a calling, a dedication to improving the lives of people in our country. And so we're trying to bring people back to that, and at the same time have ways of making sure that they take care of themselves. So we've got a lot of wellness and well-being programs going on.
Good for you. Good for you. Colleen, you have done so much. What do you consider your greatest achievements?
Well, Fawn, it's not me. It's always my team. And I tell you what, I have surrounded myself, and I am so lucky to have some of the top healthcare professionals and strategy thought leaders in this country, I believe, that are all focused around, a vision and a mission and being a part of something bigger than ourselves. So we've been able to accomplish a whole lot here at Kroger that we're really, really proud of. I know, from being picked as APHA's immunization champion in last year, which we thought was a really big deal. And it was picked around people that went and were able to get to the communities that were the underserved communities. we were able also with testing to put together the first walk-up site down in Dallas, Texas, under the AT&T Stadium. There is a 1,000 or so homeless people that live underneath a bridge, and we were able to build the first walk-up site for testing. So, I mean, things like that really make me proud of what we stand for and, where we're going. So I don't think that there's one thing that I say, oh, that's the big one. One thing that I will also note is that the bringing together and the launching of the Kroger Health brand was a really big deal for us. So we brought together our pharmacies, our clinics, our dietitians, our specialty pharmacies under one collective strategy, to go out and stand for a vision and a mission, like I talked before. Our purpose, by the way, at Kroger is to feed the human spirit. And we don't have that word feed in there because we sell food. We believe that people are hungry for more than food. They're hungry for uplift, for a smile, to connect with people, to go where somebody knows their name. Yeah. So I think some of the greatest accomplishments have been around just us coming together saying, we're going to make this world a better place. And we are going to go do big things together, meaning pharmacists, nurse practitioners, dietitians. That's what I love about it, is sort of the collectiveness of the professions to stand for something that is much needed, I believe, in our country.
Love it. And I just absolutely love your passion. So thank you for that. What keeps you up at night? And more importantly, what gets you up in the morning?
Wow, what keeps me up at night? I always want to make sure that we're doing all we can to keep people safe. I mentioned safety in the very beginning of this. Are we doing all we can to protect our, healthcare professionals, our nurse practitioners? And as far as patient safety is concerned, are we doing all we can on the front lines of the front lines? I think also what keeps me up is, are we moving at a pace that matters? Because healthcare is changing so quickly, and it's changed so quickly over the last 5 years, and I'm sure it's going to over the next decade. Can we continue to move at a pace that matters? And also, can we keep the talent? Yeah. It's one thing to be able to keep some of the top people in the country, to be able to drive a strategy, and to be able to run 2,200 plus pharmacies in the country. Sometimes I worry about that. But what gets me up in the morning and gets me going is just the people, and the people that I'm able to work around, and the people I'm able to work for. It's about inspiring others. I always say that if we want people to do what we need them to do when we're not looking, when no one's watching them. So if someone walks up to our counter and we will close at 8:00 and it's 2 minutes till 8, and they have 13 prescriptions, are we telling them they need to come back tomorrow? Or are we going above and beyond and making sure we take care of the customer? Those are the types of things that, and sometimes I worry about, and at the same time inspire me, because I believe we are where people visit more often, or where people live, right there in the community. We are the front door of healthcare, and we can be. And so those are the things that get me up. And I think, wow, we can so make a difference too in the nutrition security in the country, because we are the country's largest traditional grocer. Can we really move the mark on nutrition security? And I believe we can. And Rodney McMullen, by the way, our CEO, great man, awesome leader, inspired by him for sure. One of his goals is he wants to change the way America eats. And when he says that, I say this often. If people heard me do another interview, they know I've said this before. He didn't say he wants to change the way that people that shop at Kroger or the Kroger banners eat. He says he wants to change the way America eats, really helping people understand the role of food as medicine, so we can prevent illness before it starts. I mean, if that doesn't excite you, if that doesn't excite other people, where you can actually prevent illness, and that my grandchildren that I will hopefully have someday, that it will be a different world, that things that are being sold on the shelf are actually better for you, and people don't even realize they're better for you. Yeah. That's the kind of stuff that, I get excited about.
So let's talk about role models. My father was my role model. He was my hero. Is there someone in your life who inspires you?
Yeah, well, there's a lot of people in my life that inspire me, but yeah, I would say that my mother and father both come from a background, a pretty tough background. Mom, 5 kids, never had her own bed until she moved out at age 16. But my mom went to nursing school early on. She tried to go to nursing school, and then she contracted tuberculosis and had to be quarantined for a while. Got out and never got to go and sort of like live her dream. But the impact that she has had because of the person that she has had on others and the things that she has chosen to do has just been pretty amazing. My mom was a gospel singer, and she used to go around and travel to different states, and we would go with her, and just the impact that she had through the talent that God had given her around singing, and then how she has always given back, even though she hasn't had much herself, is really inspiring to me. So I try to work as hard as my parents have worked in life, but I mean, without them, I wouldn't be where I'm at today. But yeah, I would say that my mother and my father too, I mean, hard worker, but just some things that people, when they have to go through certain things and then they overcome them, but they keep pushing on. And she's still, by the way, the choir director today, and she's 82 years old at her church. So
Good
like
for her.
what I think is amazing is that she dedicated her life to something, and she said, this is what I'm going to do. Like no one's going to stop me. So that inspires me.
Great role model. Thank you for sharing that. Colleen, it has truly been a pleasure and an honor talking with you today. Thank you so much for taking the time out of your busy schedule to be with us and sharing your story with us today.
Well, Fawn, thank you so much for the invite. It's been awesome meeting you and getting to know you. So I look forward to the next time that we get to connect.
Thank you. And thank you, everyone, for joining today. As always, I look forward to seeing you again at the next Fridays with Fawn. Thank you.